At the core of the foundation lies the profound broad vision of fostering collaborative cancer control and prevention throughout the West African sub-region. Through a number of initiatives including cancer awareness programs, community awareness and outreaches, funding of radiotherapy treatments, and support for survivors and caregivers, the Foundation has been able to give support to individuals at risk of cancer and those with cancer through these initiatives.
My name is Professor Chumi Wogu. I'm the chairman of the board of the Foundation for Cancer Care. I am a thoracic surgical oncologist and a cancer epidemiologist. I also do other things. I wear other hats. I'm the CEO of Lakeshore Cancer Center, and I'm a thoracic surgeon at Roswell Park Comprehensive Cancer Center in Buffalo, New York, in the USA. Now, in terms of the foundation, what inspired us to start the foundation was the recognition that there wasn't a lot of effort at the time. This was in the mid-2000s. There wasn't a lot of effort directed specifically at solving the dilemma of cancer in our country. Okay, so we thought it would be necessary to start a foundation that focused specifically on cancer control in Nigeria and hopefully all of West Africa. So that's how the foundation started. So we believed that a good way to proceed was to focus on education, letting people know that cancer is not something that comes upon individuals because they are bad or evil or because they are cursed, that it's just something that oftentimes happens sporadically. So we wanted to let people know a lot more about cancer, that there's nothing to be ashamed of, there's nothing to be hidden, so that it's not a death sentence. So these are some of the things we wanted to educate people about. But in addition to that, we wanted people to have the ability to get accurate diagnoses, because that then leads to appropriate treatment, and for people to be diagnosed early. So early detection allows people to potentially be cured. And sometimes you can even detect things in the pre-cancerous state when they can be eliminated and not have cancer at all. So these are some of the motivations that led to the start of the foundation. But as the foundation began, we also realized that we needed a center to provide accurate and modern treatment. So in collaboration with Roswell Park, the foundation set out to establish Lakeshore Cancer Center. So it was the foundation that gave birth to Lakeshore. So right now, in addition to education, we also raise funds to try to provide care for those who can't afford it. So we've been successful in raising funds for people to get radiotherapy. We usually refer the patients to NSIA Luth for radiotherapy and cover the greater proportion of the cost of that care. We would like to do more of that, extend that to chemotherapy, extend that to surgery. But the biggest challenge is funding, having adequate funding. So we come up with different programs, cancer walks. We have a charity golf tournament called the Swing Against Cancer that we've done so far at the Ikoyi Club 1938. We're planning to have one more early next year. But the idea is to raise awareness again, raise money. Golf is something that is fun. A lot of people do it. It gives the golfers an opportunity to contribute to the betterment of society. So these are some of the things that I wanted to share today about the foundation, but I'll be glad to answer any questions. Thank you very much.
Hello, my name is Abimbola Faponda. I am an assistant professor at the School of Public Health, University of Pittsburgh in the United States, and a board member of Foundation for Cancer. I am excited to share my thoughts about the commendable achievement made by the Foundation. My journey started 7 years ago When my mother was diagnosed with end-stage colorectal cancer, she was treated at Lakeshore Cancer Center, where she received an excellent palliative care. My background in public health and my personal family experience motivated me to do something about cancer. When an opportunity arose to become a board member in 2021, this was an opening for me to contribute by working with and becoming part of a dedicated and caring team. In our 2 years together, we've made considerable progress and taking care of individuals diagnosed with cancer. 17 radiotherapy treatments have been funded, over 600 mammograms and 1,000 clinical breast exam and cervical cancer screening has been provided. We are proud of our achievement and look forward to continued contribution improving cancer outcome for individuals through education, awareness, screening, and treatment. Your support is very much needed. Thank you.
My name is Tolulope Adeyola Oladipupo. I'm the Programs Manager at the Foundation for Cancer Care. The Foundation for Cancer Care is an organization, a non-profit that's focused on cancer education, cancer prevention, cancer screening and treatment. We also coordinate the support group of Lakeshore Cancer Center called the Dewdrop Support Group, which is a group that consists of cancer survivors. So basically, that's what the foundation does.
Hello, my name is Wayne Binoba. I love nature. I'm a cancer patient. I was diagnosed with breast cancer of the right breast sometime last year, June 2022, to be precise. And since then, I've been undergoing treatment. I went through a surgery, we had to take off some tissues from the right breast and then also some lymph nodes from under the armpits. And after that, I had to go through chemotherapy. So I had 8 cycles of chemotherapy, and that was something for 6 months. It wasn't easy at all, but anyway, I did finish that, and then I had to go for radiotherapy. I completed the radiotherapy sometime this year, June 2023, and since then I've been going through some recovery, which I feel is good. Radiotherapy really took a lot for me. My weight, I lost a lot of weight, and also my color changed, and also had it bad sore throat. I had to go through for some time. But after that, I really, really want to say thank you to Foundation for Cancer Care, because they came to my aid. Without them, I wouldn't have been able to go through the radiotherapy, because I had a huge sum of money I needed for that, and they did that for me. I'm very, very, very grateful. It's already 18 months since I started this journey, and recovery has been going on well. I really feel more healthy at this time, and I'm going to give glory to God for everything, and thanks to all those that really assisted me in different ways. I can't even mention. Thank you so much. Thank you. That's my story.
Good afternoon. My name is Prince Jules Justice. I am brother to Miss Jules. I want to use this opportunity to say a thank you so much to Foundation for Cancer Care for coming to our aid and helping with the treatment, funding part of the treatment of my sister, Miss Jules. My sister was diagnosed of invasive carcinoma of the right breast. So it was on one of the treatment sessions at Lute when she was going for her chemotherapy that I met one of the patients during our conversation. So she asked how we are managing with the funding for her treatment. I told her that I was going about it all by myself. So she told me about a foundation that was helping her with funding her treatment. So she gave me the contact for the foundation. I called them. Unfortunately, they were overbooked and people on the waiting list was much. So the foundation now told me that maybe I should reach out to Foundation for Cancer Care if they could help. I reached out to Foundation for Cancer Care. One Mrs. Amanda picked up the call, and ever since then, from that point, it was all encouragement and the good news. So the foundation stepped in with funding the a radiotherapy. The fund was sent directly to the hospital in Sierra Leone Center for Cancer, and my sister went for her radiotherapy. My sister is fine. She's on her feet. She's done with her treatment. And I want to say a thank you to Foundation for Cancer Care. Thank you to Miss Amanda, even though I have not met you in person, but God bless you. God bless the foundation and everyone that is part of this foundation, helping Nigerians, putting smiles on the faces of Nigerians in a time like this. I want to say we are grateful. Thank you so much. God bless you. God bless you. I know I will shall be part of this good news, this movement that is helping Nigerians. I will definitely be part of it. I want to say thank you and God bless you. We are very grateful. Thank you.
Hello, my name is Ronke Cheje and I am a member of the Dewdrops support group. I joined the Dewdrops support group, as the name implies, for support and for knowledge and also to contribute my expertise. Number one benefit so far would be that I know I am not alone on this journey, so it's an avenue to meet other amazing people. And secondly, the group helps with knowledge, awareness. And I would say a third benefit I have had so far would be that you get invited to special events. And also the fourth one would be that I have been able to contribute some of my knowledge to help others in the group, just the way they've done as well. So overall, Dewdrops has supported me in my recovery journey, and I would say it's a platform for everyone to join. So long as you seek knowledge, it's a platform for you to join. And thank you.
Hello, my name is Amanda Yadel Uboji and I'm the Programs Officer with the Foundation for Cancer Care. As we all know, many organizations face challenges along the way, especially non-governmental organizations, regarding the economic situation of the country in Nigeria, which limits individuals and organizations from donating to our cause. Another issue we face regarding fundraising is from the aspects of CSR. Many of the times, we do not find organizations that have their CSR aligned to our mission. This is just a summary of some of the challenges that we face at the Foundation for Cancer Care. Apart from our fundraising activities at the Foundation for Cancer Care, other ways we've been able to raise funds are through individual donations and donations from organizations. Briefly now, I'll be talking about ways that you can support the Foundation for Cancer Care. Some of the ways you can help us is one, through advocacy. You could leverage the social media and share our posts, repost, retweet, and reshare via all our social media accounts. Another thing you can do for us is to offer us pro bono services. We would also appreciate donations of technological devices such as cryotherapy machines and any device that you think will be useful in our work on cancer care. We're big on partnerships and collaborations. If you would like to fundraise on behalf of the Foundation for Cancer Care, you can reach out to us and we will be happy to support in your goal to aid the Foundation for Cancer Care. Thank you very much. In a world where the battle against cancer can be overwhelming, the Foundation for Cancer Care stands strong, driven by the collective determination of board members, staff, volunteers, partners, and donors. Our unity, compassion, and dedication light the path towards a future free from the grips of cancer. Join us in amplifying our work, supporting our mission, and together let's create a world where cancer is no longer a devastating reality. Together we can.